the Global Fund to fight AIDS, TB, and malaria has contributed significantly over the last decade in accelerating India's response to TB, HIV, and malaria, saving lives and preventing infections. However, a lot more needs to be done, as it is clearly not enough. If the Global Fund and India do business as usual, populations that are currently unreached are not likely to be reached.
Over the last 10 years, I think the Global Fund has focused on strengthening national TB programs in many countries. So they've poured money into national programs, they've provided infrastructure, they've trained people, they've built capacity, they've provided drugs, they've supported processes, and NTPs are much, much more functional now after Global Fund intervention than they were 10 years ago. The problem is that NTPs still are not able to use all of the money that Global Fund gives them. Plus, there's a significant proportion of the population that they still do not reach. And most of these are usually the most vulnerable, the most socially marginalized, and the most poor. I think it is stretching management to imagine that NTPs, if they are continued to be supported, and they must be supported, will actually ever reach these populations. They won't. So if the Global Fund wants to do something more, they need to invest in the sector where people from these populations currently seek services. The poor person, when he's not well or she is not well, goes to a particular service. They're going to continue to go there when they're not well. You can't expect them, for TB alone, to suddenly be educated and made aware that they will go to a public service. It's going to be universally the same. And that means that the Global Fund needs to invest in the community. This is where the last mile is. If you've got to 60% case detection, you want to find the other 40, it's not going to be found by the program on their own. It can only happen if the other sectors get an investment. The challenges are there in terms of standardization, blah, blah, blah. But I'm sure we can find answers.
I don't know whether they'll consider India within the list of eligible countries or not now.
Right.
But India should remain high on their agenda criteria. At least for TB, we are the highest burden TB
Right.
in the world. Number two, I feel their reporting mechanism is too stringent. They go too much into micro details.
Right.
It eats into a lot of time and leaves very little time for program implementation first. I mean, all the time you are just doing documentation. They could also put some money into health system strengthening. Now go cross-cutting. Health system strengthening is like medical approach to lung health, TB, diabetes, TB, HIV.
Right.
Maybe setting up more labs and all these all become part of health. Silicosis and TB is one area. So there are many areas which are emerging. So each disease will have specific issues related to health system strengthening.
Right.
These only steps to actually scale up or public-private mix approach. Actually see how more and more civil society can be absorbed in, especially in difficult terrain. Society is always available within cities, rural areas also, but difficult it is very difficult to maybe give them higher allocation for difficult terrains. Maybe allow them to set up infrastructure there also. Because if a civil society does not have an infrastructure in these remote areas, they will not work there.
I think they can do less with all the middlemen so that the fund reach to the community that are meant to reach the most. Because if you look at how the fund trickle down with the PR, SR, SSR, SSR, so finally when the fund reaches to the community level, it's very less. So definitely they can do away with it. And Global Fund has lots of paperwork and lots of system and structure that means to protect and prevent from whatever corruption or misleading. But it is evident now that this system and all these formalities is not really preventive, and simplify the process so that the people who are mean to get it, they can get it, not just some consultant. I believe there are many other models to be looked like ITPC collaborative fund is one example that we minimize lots of people and we can give disburse funding to the community to even, we don't care even if you are not registered or not. As long as you do work, we will find how to get the money. That's our job. And we do it, and we do such a integrated amount of work, especially in South Asia, where I coordinated. I'm the coordinator of South Asia. I can see that with 5,000 grants, I can say that Bangladesh has not just start ARV program, but they have start manufacturing. With the small advocacy money that they give, they lobby with the government, with the pharma company. Today, Bangladesh, they don't provide ARV, but they also produce ARV. Nepal, look at Nepal doesn't produce, so there are a good model that can be repurposed and must look into it and minimize all the middlemen and all this paperwork, and that would enhance the program efficacy as well as the money that it means for getting to the real people who are supposed to. That is one thing they can do less and optimize the fund.
The structure of global fund has to be more expanded to ensure that communities are represented as well as civil society and not controlled only by governments.
The situation won't change by much. In our setting, it is a setting for fraud. It is a setting for mismanagement. It is a setting for limited capacity. It is also the setting for high burden of tuberculosis, for high levels of poverty, for low literacy, for no education, for everything that is wrong with society. That's why we need the global fund. And so they need to build systems that will help local managers audit their work and carry it out with integrity. We need to think of ways this will align with best practice. It will not always be what you can do in Wall Street. You know? But we should be able to do it locally at the village level.
Its processes to build in-country competence to manage the grant and implement programs effectively. The need to engage affected communities as equal partners with dignity in this process is vital. The communities need to be in the center of India's response to HIV, TB and malaria, and not merely on the receiving end.